Today we are going to discuss about some diseases related to the heart. The first, that is the coronary artery disease, or it also may be called ischemic heart disease. Or it may be called as ischemic heart disease. What happens in this condition? The coronary arteries providing blood supply to the heart itself, they are blocked. The coronary arteries providing blood supply to the heart itself get blocked due to the formation of plaque. When the coronary arteries providing blood supply to the heart, they block, or the formation of the plaque leads to decrease in the diameter of the vessels, the oxygen or the nutrients reaching to the particular region of the heart, they become decreased, and this decreases causes hypoxia in heart muscles and heart tissues. This condition causes a pain in our chest, and this is what we call as angina. And there are two types of angina. One is stable angina and the other is unstable angina. So what happened in here, there is due to the formation of the plaque, that is the plaque formation, oxygen to that area become decreases, the nutrients providing that the region, they also getting down and decreases, and this decreases to that particular region causes a pain, and this pain is called angina. And there are two types of angina. What is stable angina? Stable angina. The other one is there is unstable angina. Unstable angina. Suppose I take the section of this heart muscle, the region, the arteries providing blood supply to this, they form plaque. Because of atherosclerosis, a plaque is formed in this artery. What happens? The diameter decreases, and this decrease in diameter causes less blood flow to the particular region of the heart. This condition is still providing oxygen to the region of the heart. So it is temporary coronary disease disorder, or temporary, we may say, as angina. So this condition what we called as stable angina, because it is not so dangerous. If the plaque is not fixed, it is not stable, it is a dynamic plaque, then it will be dangerous to that particular region of the heart. For example, the plaque is formed like this, dynamic plaque. It's moving here and there, and this formation, this is what we call as dynamic plaque. And this is what we call as fixed or static plaque. As this condition is what we call as unstable angina, and where the plaque is fixed, this condition what we call as stable angina, where the plaque is fixed. Plaque fixed. And here the plaque is dynamic. Plaque there is dynamic. This condition, if this condition is so severe, that the plug completely block the artery, then that area will die, the cells of that area will die, and this portion fail to contract. So this condition leads to some severe problems. And the second one is the second defect, that is dilated cardiomyopathy. Dilated cardiomyopathy. As the name representing, that it is the dilation of muscles of heart. So in this condition, what will happen, that the heart muscle, mainly the ventricular muscles, they become dilated. They become some like bulge outside. So this condition, what we call this condition is dilated cardiomyopathy. The result of this dilated cardiomyopathy causes less blood ejection from the ventricle to the aorta. Because it is dilated, it loses from contraction stability. It will not contract as strong as it previous. So it causes the ejection of less blood from the ventricles to the aorta. So we can say that it is systolic disorder or systolic dysfunction. Ventricular muscles dilated. Contraction ability decreases. And the third one, that is it also called as systolic dysfunction. The systolic dysfunction, it will not contract fully, and due to as a result of this systolic dysfunction, less amount of blood is ejected to aorta, and this less ejection of the blood to the aorta, what they causes to stain. It means that when the 100% blood come to the left ventricles, for example, 100% blood come from the aorta, from the left atrium to the left ventricle, and the blood amount of the systolic volume, less amount is going to the aorta, that is 50%. So what will happen, the end systolic volume in the ventricles increases. This increase in end systolic volume into the ventricle, what happened, create a pressure in the ventricle. This pressure what will cause this pressure then shifted to the left atrium, and this left atrium pressure, it will push or the create pressure on the left atrium. This left atrium create a pressure on the pulmonary veins, and this pulmonary vein create a pressure on the fluids coming from the lung. So what will happen as a result of left dilated cardiomyopathy? As a result of this, the pressure exerted on the lungs, so fluid is resist to come to the ventricles. So this resistance against the fluid coming from the ventricle, from the lungs, causes a pulmonary edema, the fluid try to sustain or to remain into the lungs, and this remaining of the fluid into the lungs for the longer period of time increases the hydrostatic pressure into the pulmonary veins or the pulmonary arteries, and finally the due to this increasing in pulmonary hydrostatic pressure really causes the fluid to come out of the vessels into the interstitium and increases the amount of the fluid into the extracellular spaces, and this extracellular space increasing its fluid causes pulmonary edema. It will cause in also dilated cardiomyopathy, restricted cardiomyopathy, and all the conditions related to the left ventricle causes the pulmonary edema. It is pulmonary edema. I will write here. It will cause pulmonary edema. This is about the dilated cardiomyopathy. The second one is there is restricted cardiomyopathy. Restricted cardiomyopathy Restricted cardiomyopathy, as the name here again suggests, showing that it is some sort of resistance or the restrictions. That what happened in this condition? In this condition, the muscles of the heart will not change its fashion. The muscles will neither elongate it nor hypertrophy. It will remain in its normal condition. It will remain in its normal condition, but it loses the strength to get fully relaxed. It will not relax. It will not come. It will not preload. When the blood come here, definitely the blood exerts some pressure on the wall of the ventricles. As a result of this pressure exerting by the blood, the ventricles comes down, mean it's dilated, it's relaxed, its size is increases. So in this condition, what will happen? Because of some pathological diseases or some other circumstances of the factors which causes to stop the heart's relaxation, so the heart will not elongate, not dilate. So what happened in this condition? The heart muscles structure not change. That it will neither become hypertrophy or it become dilated. So it will not change. It will remain its normal condition. That is mean that it remains in normal condition. Remains in normal condition. But what happened? The thing is that the heart, and mainly the left ventricle muscles become restricted to contraction, to relaxation. That it will not dilate, not fully dilate. So when the heart will not fully dilate it, the blood coming here less blood will come into the ventricles, and this again create a pressure on the atrium, and this again create a pressure on the pulmonary veins, and it also create a pressure on the capillaries into the lung, and this again causes the pulmonary edema. It also causes pulmonary edema. Pulmonary edema. So it's some type of resistance showing to the relaxation. So this is about restricted cardiomyopathy.